we are going to talk about the thyroid today. And the thyroid, why does it not do that? The thyroid is what so many people like to blame for so many things. And if we were to think about thyroid symptoms, you can immediately name 5 of them: chronic fatigue, hair loss, inability to lose weight, maybe even some low libido. The list goes on and on and on. But when it comes to the thyroid, there's a couple myths, and let's crack these myths right now. I'm going to share with you my screen, okay? So give me a thumbs up, guys, and then shout out in the chat. You can see my screen. It's blank. It's basically a whiteboard. Okay, Dr. Zahedi's giving me a thumbs up. Thanks. It's always good to see your faces. Don't be afraid to turn on your camera. Okay, and then I see a couple hands raised, which is awesome. If you guys have questions, you can go down in the bottom and raise your hand. We'll get to the questions at the end. There'll be around 20 minutes at the end where we can just I'll purely answer any question you have. And then there will be limited access replay to this. I will send you a follow-up email this afternoon with the replay link. It will be available via a private link from a YouTube video throughout this weekend until Monday, then it gets taken down. So Karen and Heidi are here. Mindy's here. Karen's here. Love it. All right. The thyroid. It is just one system in the body. Not even a system. One piece of a system inside us. And we're going to talk about this system today. There's 3 key pieces. Okay. And because I'm such an artist, you're going to see this beautiful drawing. Inside this system are the 3 pieces, right? At the very top of the totem pole, we're going to call him H. His name is hypothalamus. He's part of our brain. The middle guy on the totem pole is called P for pituitary. If you were to draw 2 lines on the center of your head like this, down the center, down vertical and horizontal, where they cross is this little tiny itty bitty gland known as our pituitary gland. He's really, really important because our pituitary gland produces this hormone called TSH. TSH is the standard blood marker in which we get for our thyroid, but as you just learned, the TSH is not a thyroid hormone. It is a pituitary hormone, and the pituitary, P, uses it to talk to T, our thyroid. Okay. Now, jump inside the comments, and if you are a practitioner, tell me how frequently do you see people take for a thyroid lab more than TSH? If you are here to read your own labs, awesome, because that is power in your hands. Inside your labs, give me a yes or no if your doctor took more than TSH. And if they didn't, ask them to next time. On any given lab test, a standard lab test, the normal TSH value is between 0.5 and 5.5. Now, that's a big range, right? That range is why so many people have thyroid symptoms, yet keep getting told their thyroid labs are normal. So what we're going to do and what I'm going to teach you today is we're going to take that normal range and we're going to condense it into something smaller. That smaller range is now this, 1.8 to 3. Okay. Now, if your TSH is at 1.4, you're still normal. You might feel okay. Ability to lose weight is probably impossible. Energy levels, well, you just keep getting told you're a mom. But if your level is anywhere, any low at all, which most of the time it is, if it's high, I prefer it to be high than low. If it's high, think medications and think possible Hashimoto's. So we're going to focus on the low side of things here. If your TSH or if any patient's TSH is less than 1.8, we then have to think about what is causing P to have a hard time producing TSH. And there's typically 2 reasons that impact P. The first reason is this lovely word called stress. And the next reason is this other lovely word called inflammation. So stress and inflammation are directly impacting TSH production, which then goes down to talk to T, our thyroid. How many of you are stressed? Raise your hand. How many of you think you're fighting inflammation? Raise your hand. Everybody is stressed. Everybody is fighting some type of inflammation at some little teeny level or larger level. Here's the thing. We live in 2022. Stress is abundant. If you're not stressed, you're lying. So what if we find the stress on the inside of our bodies? Because chances are the stressor that's on the inside of our body is the same thing that's causing inflammation. And if we can find this internal stressor and remove it, then we're going to be able to handle the external stressors, life, much easier. Right? Who is totally cool with finding an internal stressor and not having to worry about changing our dramatically stressful life? Well, I can't go into it today, but I did go into it last week and I will go into it next week. The internal stressors can usually be found inside the CBC. They are those infections. Okay. Research has it that 95% of Hashimoto's began with a viral infection. 95% of the labs I've seen, and I've seen thousands of them, this internal stressor is some type of infection, and it can be found inside that CBC. So go inside the CBC, check out the other video from last week or 2 weeks ago on the live we did there, or come join me on Monday, and I will teach you exactly how to find what type of infection your body is fighting. Okay, so if we get rid of this internal infection, we're removing the internal stressor and we're combating the inflammation by removing a big source of the inflammation. Now our TSH goes up, it talks to the thyroid better, which then produces T4. Are we following me? So inside your blood work, a very basic thyroid panel, make sure it contains TSH and make sure it contains free T4. Okay. T4 gets produced by the thyroid, but it doesn't really do anything until it gets converted into T3. So now that you know, one of the easiest ways to treat the thyroid by not treating the thyroid is to figure out the internal stressor, aka the infection. The second piece of treating the thyroid by not treating the thyroid is making sure T4 gets converted into enough T3. There's two places that conversion happens. Inside your gut, your small and large intestine, and inside your liver. So if your gut has problems, your thyroid's going to have problems. If your liver can't keep pace with all that it's supposed to do, your thyroid is going to have problems. Now, why should you even care? Well, T3 is kind of important. I mean, he's really, really important because T3 is going to go out and talk to every single cell in the body. T3 communicates with our body, tells it to speed up your metabolism so you can lose weight. It tells it to strengthen your hair so your hair is not falling out and becoming really thin. It tells your body to regulate your body temperature so you're not cold while everybody else isn't. It tells your body to have healthy, strong nails and skin. I mean, T3 literally talks to every single cell in the body. So if you don't have enough of it, you're going to show what we know as the thyroid symptoms. The way to conquer T3 and T4 without thyroid medication is to conquer the internal stressor and maybe even support the stress system, the adrenal glands. The way I look to support the stress system is with a supplement called GA. Maybe you can fight inflammation directly with something like CVO, a supplement. And then be sure your gut's working well and your liver's handling everything it needs to do. That right there is the 4 simple steps to treating the thyroid without treating the thyroid. All based on if the TSH is low. What if the TSH is high? Again, think medications and think Hashimoto's. Now, besides free T4 and free T3 and TSH, be sure your doctor is ordering TPO and TG antibodies. If you're a practitioner, make sure you order these because that's going to help us determine if there is autoimmune with Hashimoto's. And if there is autoimmune with Hashimoto's, now it becomes autoimmune protocol. But again, autoimmune protocol always goes back to figuring out the trigger, and 95% of the trigger for Hashimoto's is a viral infection. Whew! Thyroid made easy, thyroid made simple, right?
Kylie, can you talk T3 and T4 or free T3 and free T4 numbers? And then rework the steps again.
From the chat?
Mm-hmm.
Okay. I'm going to pull up my cheat sheet here because I don't want to lie to you guys. Okay, can we see this, Kelly? Do I need to stop my share? Okay, let me go through the chat real fast. What are the number ranges for T4 and T3? We'll get into that just a second. Okay. Can H. pylori shown high in gut be a factor in elevated TSH? Sure can. That is
the 4 steps again.
Okay. Okay, so here are the numbers we want to pay attention to. This free T4 is between 1 and 1.5. Free T3 is between 3 and 4. Okay. So let me clear this and we'll start. We'll start clean. H talks to P talks to T by producing TSH. T produces the thyroid produces T4, and inside the labs, you're going to see it as free T4. That is between 1.0 and 1.5. Then T4 gets converted into the gut and the liver to T3, and that level is between 3 and 4. Okay, now the reason why I don't focus so much on these numbers is because so many people are on medication, and when they're taking thyroid meds, it literally is T3 and T4. Now, can you get off the medication? Well, heck yeah, you can. If you're taking T3, which is synthroid, levothyroxine, cytomel, natriurethroid, everything has T3 in it. Some things are a combination, but it's typically T3 or T4. Think about this. If we're taking T4 and T3 via medication, that's going to tell everything else upstream to shut up. I don't need it anymore. I'm already getting it in other ways. So then we start to see TSH. I've seen it numerous times where the lab says this. Less than 0.01, meaning it doesn't even exist. And they're always taking medication. It's literally telling the body, we don't need to make TSH anymore. We've already got T4 and T3. I'm not a fan of that. However, most physicians and most Western medicine trained docs don't understand that we can figure out why is TSH having a hard time? Why is T4 having a hard time? Why is T3 having a hard time? And then fix it. So when it comes to the steps, here are the 4 steps. First, find the internal stressor. Maybe even support stress with a supplement, an adrenal supplement GA. Step number 2, most likely that internal source of stress is also causing inflammation. Maybe tackle inflammation directly with something like CVO. And these are systemic formulas products. CVO is loaded with healthy fats. It's what's inside of it. Number 3, make sure the gut is rocking and rolling, meaning bowel movements are daily, once, twice a day. There's no gut complaints. And even then, make sure the numbers look good. And then you can figure out the numbers. The way I determine the numbers for the gut is the CBC with all the infections. You can do functional medicine tests, but they're typically not necessary if you know how to read that, which you guys all do because I teach that a million times. And then last but not least, liver support. So you can do something as simple as LS and bind, or you can go as far as something as a prep, body, and brain phase. Those are my go-to supplements for it. If you're talking to somebody who has heavy, painful periods, LS and bind is a great place to start. If your patient has spotting when they started birth control, LS and bind. That just means that their liver can't handle all the excess hormones. So the excess estrogen is leading to spotting. I did a TikTok video on that, and people were like, that is the only time I've ever heard a video to specifically answer that question. So there's the 4 ways to actually heal a thyroid. And then one of my other favorite things to do with thyroid is there's a supplement called Super Oxycell. It's from Apex Energetics. It is a cream. And I love the cream because they can take it and they can literally apply it right there over their thyroid tissue, especially for autoimmune. It is loaded with antioxidants like glutathione. So literally just protects the tissue. And I use it for all autoimmune cases, Parkinson's, MS, Crohn's, everything, you name it. I just have them rub it topically over the area. I've even had Parkinson's patients report that their tremors stop when they rub Super Oxycell down their spine. So pretty cool things. All right. We good, Kelly, with the comments? Okay. Now jump inside the comment, and I want you guys to tell me if you learned something you didn't know beforehand. And what was the favorite aspect, your favorite thing that you just learned in 20 minutes? You just got a 3-day thyroid seminar in 20 minutes.
Oh, Kylie, there is can H. pylori shown high in gut be a factor in elevated TSH?
Yeah. Any infection is going to destroy the thyroid. Which is why so many people are on thyroid meds and they're just taking thyroid meds because they were told to do it. They don't really feel any different. All right, I'm jumping into the chat. Let's see it. Rocky says, great review. Didn't know gut and liver affect T3. Yep. The reason for very low TSH was taking T3 and T4. Yes. And in my TikTok videos, I did 15 seconds on TSH and 1.8. Pam says my numbers are all over the place. Pam, if that's the case, it's Hashimoto's and it's autoimmune. Learning that infection is root cause. Wish I'd known this years ago. I know. So I did a TikTok video on the TSH and the 1.8. And so many people said, well, I feel better when I'm at 0.1. And it's going to be different for everybody. However, if you're at 0.1 and you feel better, it's probably because you're on some type of medication. Mindy, when do you implement the gut protocol? I do. We can talk about that in the mastermind, but I do that in the second step. Alicia, doctors told me the numbers were normal, but I felt awful. Yeah, you'll hear that so many times, which is why you're now a practitioner and you can help with so many more people. Had thyroid cancer, TSH is repressed, near undetectable, right or wrong? Let's speak about thyroid cancer and a thyroidectomy, meaning they had their thyroid completely removed, because you're going to see that more and more frequently now. Yeah, Jessica, you've been told you're a mom. Yep. That's like the most common thing ever. With a thyroidectomy, you do the exact same thing, but they will need to take T4 and T3 medication. Nodules with all normal labs. Rocky, I've actually used Super Oxycell for the nodules as well, but make sure they are under primary care doc. Partial panel for full thyroid. Yeah, that's pretty typical. If you've been prescribed Armour thyroid, don't just stop taking medication right now. You've got to make sure you're working with your pharmacist and your doctor to slowly get off of it. Cold turkeying thyroid medication is not wise. What can you take to support hair loss while doing all 4 steps? Minerals for sure. And then your stressor, because your body's going through all sorts of stuff. Super oxycell, good for psoriasis. Dr. Zahidi, I would use dermacolonizer and renovator. Those are systemic products, and the dermacolonizer has skin stuff in it. And when I say skin stuff, I mean probiotics. So you're replenishing the microbiome on the skin. Okay. How many of you would love to learn more about blood work and making blood work super, super simple? Give me a shout out in the comments. Karen says yes. Pam says yes. Heidi says yes. Yes, absolutely. Yes, please. Okay, sweet, because there are some awesome opportunities, whether you are a practitioner or if you are just here because you want to learn how to read your own labs. For practitioners, I host a mastermind. It's called Beyond the Diagnosis Mastermind, and you can find it, all the details, at btdmastermind.com. The lab course in there for practitioners goes into the CBC, the metabolic panel, the thyroid panel, the hormones even, vitamin D, all of the stuff that your patients already have, that you can save them so much time and so much money. You can now get inside that lab program, and it's certification now. So you can be level 1 certified in lab readings. Level 2 will come out in about a year, and then level 3 in about a year after that. So rock what we got now. Alicia, we'll send you a new links for it with new coupons for the fast action takers. Okay. And Dr. Zahidi, she joined us on our last call, call from yesterday, and it was so cool. I love getting new people in on those calls. We work everything from business to patient care to our mindset. For you guys who are just wanting to learn how to read your labs and maybe have some help along the way, there's the Academy. It's brand new as well. Beyond the Diagnosis Academy. You can get that information. I'll put it in the link here. And there's 3 different options for you. There's a 3-month all access pass, a 6-month all access pass, and then you can easily do month to month. But these calls are exactly what we're doing throughout the next 6 months inside the Academy, where I will be teaching exactly how to read your lab so you never have to rely on anybody else again. Opportunities galore, guys. Who has any questions?
There was a question higher up from Heidi. What is a good stress supplement? So many options, but do you have a
GA.
recommendation? GA.
GA is the adrenal support from Systemic Formulas, and it's a adaptogen. So it's going to lower or raise cortisol as needed. Okay. Jessica, I love that you have your video on. Thanks for putting that on. And Haley has got her video on. Kathy, reverse T3. That one gets a little bit complicated. However, let's keep it simple. And if your reverse T3 is less than 15, that is a good thing. If it is over 15, your metabolism is screwed. 36.9, she says. So before we jump into the all these reverse T3 possibilities, just go back through those first 4 steps. Robin, I don't get too much into the details with diet. By the time people get to me, I want them to just eat food again because they've eliminated everything under the sun. So I try to get people to have a better relationship with food and just eat again. I haven't found anything specifically with those type of vegetables. Thyroid peroxidase antibody, that's going to be another antibody for, that's TPO, actually. So when I say TPO antibodies, that's what that is, Pam. That would be the marker for Hashimoto's. All right, any other questions? Who's thinking about the academy? Who's thinking about the mastermind? Inside your email, I will send out fast action taker coupon codes. And now that we worked out some technology struggles 2 weeks ago, we're ready to rock and roll with the coupon codes this time. So pay attention to your email. I love to reward fast action takers. And like Dr. Zahidi said, the VRP mastermind calls, I mean, Tuesdays are my favorite days of the month because of those calls. So yes, Jessica, just finishing up a couple. Jessica, are you the counselor? Yeah, okay, I talked to you, perfect. That would be an epic combination. Sweet. Are calcium oxalate stones related to this? How do you, with any other weird symptom, I always go back to my roots and I pull up the CBC and I look at what is the body fighting, because if it's fighting a type of stressor or inflammatory agent like that, it's going to show up with any symptom. My book is coming out March 1st. And it will walk you through more about the labs, but more of no matter what the patient scenario is, no matter what your story is as a anybody, here's the 5 steps. And it's also inside my free download, that blood work cheat guide. There's a reason why I go through those 5 steps, and I do it with just about everybody. There are different inside each step, depending on what the labs told me, but it literally goes from unhealthy to healthy, no matter what the diagnosis. Hence the name Beyond the Diagnosis. So, okay, I am now getting rogue black hairs on my face. Is that related to thyroid? Facial hair, Karen, I want to think PCOS, and I want to think 3 supplements. So Karen, here's where I would start. Stimulin for balancing blood sugar. Femicrin for taking high testosterone and lowering it into estrogen. And the third one is adrenal support with GA. And I don't know if you're a practitioner or not, but inside the mastermind are all my protocols. And PCOS is one of them. You can actually buy the PCOS 90-day kit, and that's where I would go when any type of facial hair comes up. No ovaries, that's okay. You'll just have to take estrogen and progesterone, as you've been doing, I'm sure. But maybe even a lower dose, because that could be impacting. No, you're not doing that? We might send me an email, Karen, because we might have a different, you got no ovaries and but still the same 3 things: Femicrin, Sinulin, and GA. Those are by far the best 3 things for any hormone chaos. Is there a best time to do an anti-inflammatory diet inside a 90-day program? Which plan is best for Hashimoto's? Karen, the 90-day supplement kit for Hashimoto's, I would do the autoimmune or the thyroid, which the autoimmune is going to tackle viruses and replenish everything your body needs to stop tackling the thyroid. So if I were you, I would do autoimmune 90-day kit first, and then 2, the thyroid kit to heal the thyroid. But you got to stop the attack first. Starting to work with Mindy. Awesome. Mindy is in the mastermind. You're in good hands. GA, Sinulin, and Femicrin. Karen.
Rocky asked, are monocytes only elevated in chronic infection?
Monocytes, Rocky, are viral. So if you see them above 7%, it's going to be a viral infection. If they get above 11, 12, 13%, you could lean towards a positive Epstein-Barr virus test. But yes, monocytes, that's their job, is they fight viruses. If it's something else outside of infection, I would look more towards the white blood cell count. And if that WBC is through the roof, whoever ordered the lab should flag that down as proceed into further testing like cancer testing. Jane, you got your hand up. Feel free to unmute yourself and feel free to ask a question. Jane is also in the mastermind, guys.
Can you hear me?
I can hear you.
Okay. I have a client who has started having 2 periods a month.
That sucks. And it just happened?
No, it's on and off. She's tried to regulate it with B vitamins and chlorophyll, but it keeps coming up.
Okay. Hormones, think 2 things. Blood sugar, liver.
Okay.
So I know you use systemic formulas. So Sinulin, LS, bind, and you could even add in PS for the pancreas support.
Okay.
That will help her body flush through those hormones.
Okay. It's too much estrogen or too much?
I'm going to lean towards too much estrogen, but we really won't know unless you test it.
Okay.
But with all hormone cases, that's the very first place I always start: blood sugar, liver support. Rocky, is the viral infection acute or chronic? Doesn't matter, either one. The only way to determine acute or chronic, as far as I'm concerned, is the white blood cell count. If it's low, it's one way. If it's high, it's another way. But when I talk to people and patients, I don't want to get them confused, so I just say infection. But yes, you're right with the acute and viral with the white blood cell count. Jane, does that help?
Yes.
Okay. Karen, do you have more questions? Your hand's raised. I just didn't know if you had more questions. Okay. Overweight 23-year-old with no period. She's on birth control, but claims she takes the placebo and doesn't try to skip. Beth, what type of birth control? The pill? And then as far as iodine, sorry. I'm a practitioner that doesn't use iodine. That one is on the fence, on the border. If you're going to use iodine, test. Get an iodine test and see what levels you're at. Pam, what 90-day rebuild kit would you use for Hashimoto's and high eosinophils? Pam, show me an email. I can walk you through that one more too. Because high eosinophils are either 1, parasites, or 2, food allergies. So if you haven't eliminated the big food culprits, start with that one and then do the autoimmune kit. And then do the thyroid kit, because the autoimmune kit's going to stop the attack on your thyroid. The thyroid kit will then go and heal the thyroid and balance out all the hormones involved with that. But the eosinophils, if you haven't cut out big food culprits yet, start there before you just jump into treating parasites, because that can be a little tricky. However, there is a 90-day parasite kit for that too. Start with autoimmune. While you're doing the autoimmune 90-day kit, remove gluten, dairy, soy, and refined sugar for 21 days. And then do the thyroid kit. You'll feel like $1 million by the time summer hits. I love it, guys. This is why these calls are so good, as we all learn so much from each other.
Don't forget Beth's question. She said yes to
Was
the
it?
question. The 23-year-old.
Oh yeah, the pill, huh?
Yeah, pill.
23-year-old overweight with no period. Beth, think whenever I see young women like that and their periods are 90 days, 180 days, they're never happening type thing, PCOS. So treat it with the Sinulin for blood sugar, GA for adrenal support, because again, she's 23. We live in a stressful world, and teenagers have been, their life got taken away from them the last 18 months. So they've been hit really hard. And then Femicrine. And she should get that period back. If birth control, talk to her about that. I would prefer people be on birth control if they're not wanting to get pregnant. So I'm totally fine with people being on birth control. I prefer birth control in a way that is getting the hormones closer to the reproductive organs. So as far as my recommendations for birth control, NuvaRing, I'm not sure what they call it now, but I think it's been changed. NuvaRing goes literally up the vaginal and releases the hormones right there next to the reproductive system. The other ones are IUDs, which releases it right then and there. Just stay away from the copper IUD. It depletes zinc, and zinc is needed in reproductive health, but also for babies and growing. And when the babies are depleted in zinc, not good things don't happen. Good things don't happen if they happen to get pregnant. So Beth, yeah, for anybody, anytime you see a female with periods that are ski-wampus, except for Jane, when she's focusing on their heavy, their numerous, add in blood sugar and liver support. Liver support's very important for those. Whereas when they're ski-wampus, is that even a word? I should change that. When they're all over the place, think blood sugar and then high testosterone, which is going to, especially also Beth, if she's overweight and she's trying to lose weight, or if she can't lose weight, it's because of that high testosterone associated with the PCOS. And you're in the mastermind, so you have the full protocol. GA, Femicrine, Sinulin is the best place to start. Is iodine test a blood test? Yes, Stacy. Sure wish info was like this. Info like this was available 20 years ago. Would have made very different choices. Yeah, I always get asked, where were you 30 years ago? Well, I was 2. But now you know, better late than never. All right, guys.
Dr. Zahedi had a question.
Dr. Zahidi?
Yeah, Zahidi. What about GF? What do you think about GF?
Oh, yes, GF. Use GF if they have a thyroid. You can use the capsule or the liquid version. Liquid, you can also apply it over their thyroid, but the GF is great thyroid support. And I do include it in my 90-day thyroid kits. It's just not my go-to. I like to do all the other thyroid things. Alicia, do I like TMI? I used to use TMI. I haven't used TMI in like 3 years. TMI contains iodine, and that's why I'm hesitant. But I do know a lot of other people will use it, and they just do it 1 drop, and they slowly work their way up. But I've been successful without ever using iodine. I only used it in 1 Hashimoto's case way back in my early days. But I would prefer to see an iodine lab test before I start using it. Yeah. Okay, remember we have the 3-day challenge that's happening next week, Monday, Tuesday, Wednesday. The practitioners, your call is at 12:30 p.m. Eastern. Again, it's free all 3 days. And for those of you who have no medical background, your call is at 2 p.m. Eastern. You'll get all those in the emails. If you know somebody who needs to join us on those 3 live free days next week, tell them. All they have to do is join the email list, and they can do that by grabbing their free blood work cheat guide. Just make sure that they subscribe. Otherwise, they're not going to get the emails. Mina, the challenge is Monday, the CBC, Tuesday, the metabolic panel, and Wednesday is the lipid panel. So the basic standard blood work that we all have, you can now become the best person to read your own labs. You can find all the details on that here. I'll shoot the link. That has more information about the challenge. But yeah, happening next week. All right, guys. Have a great day. And I hope to see you in the mastermind, or I hope to see you in the academy. The academy calls are the first and third Wednesday of every month. They will replace these calls. And the mastermind calls are the first and third Tuesday of every month. So yes, you're welcome, Kathy. You're welcome, Alicia. Thanks, guys, for joining. Does the challenge cover the same info that's in the academy? Maren, no. Yes, no, yes. Some similar. The academy has so much more than just our live calls, but on the live calls, we're going to be doing these labs just like this.
Are you going to send email for the those challenges on the Monday, Tuesday? Okay.
Yeah.
Thank you.
Yeah, you'll get some emails about it the next 2 days as well.
Thank you.
You're welcome. And Maren says, I'm in the academy just checking. Yeah. Sweet. All right. See you guys. Have a great day. You'll get the replay link in your email.